Dr. Hans-Henry P. Kluge, the World Health Organization's Regional Director for Europe, delivered a powerful message at the 74th Regional Committee for Europe. He stressed the urgent need for more resilient health systems across the continent. Recent challenges have exposed vulnerabilities in healthcare infrastructure. Dr. Kluge called for collective action to fortify these systems against future threats. The COVID-19 pandemic has tested the limits of even the most robust health systems. We must learn from these experiences and strengthen our defenses. Investing in health systems is about building a foundation for long-term health and well-being. Strong health systems help prevent and control disease, provide quality care, and protect citizens. Dr. Kluge's message resonated deeply with health leaders and policymakers across Europe. His words serve as a rallying cry for increased cooperation and investment in the health of all Europeans. Europe's health systems are grappling with a convergence of challenges. The COVID-19 pandemic continues to pose a threat, albeit in a less acute phase. Climate change is leading to more frequent and severe heatwaves, floods, and other extreme weather events, straining health resources. Adding to these pressures is a growing shortage of healthcare workers, particularly acute in Europe. This shortage puts immense strain on existing staff and can lead to longer wait times for patients and compromised quality of care. The COVID-19 pandemic exposed and exacerbated existing weaknesses in health systems, highlighting the urgent need for increased investment and reform. These interconnected challenges demand a multifaceted approach. Addressing climate change requires a global effort to reduce greenhouse gas emissions and mitigate the effects on health. Tackling healthcare worker shortages requires investments in education and training, improved working conditions, and policies that attract and retain healthcare professionals. The COVID-19 pandemic forced many health systems into crisis mode. Hospitals were overwhelmed with critically ill patients. Routine healthcare services, like cancer screenings and elective surgeries, were often delayed or disrupted. This disruption has had a ripple effect on population health, leading to worse outcomes for some patients with chronic conditions. However, even in the midst of a crisis, the need for routine healthcare does not disappear. This duality presents a significant challenge for health systems. They must be able to respond effectively to emergencies, while also maintaining essential healthcare services. One way to address this challenge is through a dual-track approach, creating separate pathways within the health system for managing both acute crises and routine care. This separation helps to prevent the healthcare system from becoming overwhelmed and ensures that patients can still access the care they need. Section 4. Pillars of health security: preparedness, surveillance, and response. National health security is paramount. It's about a country's ability to prevent, detect, and respond to health threats. This includes infectious diseases like COVID-19, but also natural disasters, bioterrorism, and other public health emergencies. A robust health security system is essential for protecting citizens and ensuring the stability of nations. Preparedness involves having the necessary plans, infrastructure, and resources in place before a crisis hits. This includes having a well-trained healthcare workforce, stockpiles of essential medical supplies, and surge capacity in hospitals. It also means having strong public health surveillance systems in place to detect and track potential threats early on. Surveillance helps us understand disease patterns, identify outbreaks early, and track the effectiveness of interventions. Response refers to the actions taken to control and mitigate the impact of a health emergency, including isolating infected individuals, tracing and quarantining their contacts, and providing medical treatment. Section 5. Cultivating a safe and respectful workplace. WHO's Zero Tolerance Policy? The WHO has a zero-tolerance policy for workplace harassment, abuse, and exploitation. Everyone deserves to work in a safe and respectful environment. This is essential for creating a productive and healthy work environment. The WHO is committed to a culture where everyone feels safe, respected, and valued. This includes promoting gender equality, diversity, and inclusion. Robust policies are in place to prevent and address harassment and abuse. The WHO's commitment extends to all individuals who interact with the organization. By creating a safe work environment, the WHO can attract and retain the best talent.